for every $1 spent on prevention, it saves $7 in treatment costs and $14 in societal costs. Wow. So, every one of those dollars is helping keep kids out of jails, all of...
No, I love it. So as a health scientist, amazing. Right, when I think about health, we talk about social determinants of health, right? So sometimes we think health is just what one person does and what they do with their doctor, but the reality is health, all of our health is determined by all these different social determinants, and a healthy and an important aspect of public health is looking at those things. And what you're doing, we also know that there's social determinants of criminal behavior, social determinants, of that it's not just a single person's, choosing whether they end up in jail or not. There's a lot of social aspects that influence, and you're focused not just on, I got to arrest the bad guy, but you're focused on how can we influence our society in such a way that we don't need to arrest as much. That
these kids are not born like that. They have to learn it from someplace. But, people don't realize the importance of mental health. And when I say mental health, I'm talking about things that I have to deal with all the time that are directly related to mental health. That's why when I started my mental health unit, people looked at me and said, "You're crazy because this isn't your job." And I explained to them, it is my job. Family violence, domestic violence, workplace violence, substance abuse, the school shootings, they're all mental health issues. Now, that doesn't mean everybody that's got mental health is dangerous, but that's one of the things that's involved in it.
That's right. Sheriff, for our listeners, talk a little bit about your mental health unit. This is such a powerful thing that you started.
It is, and I started it about, it's been 11 years now ago. And it came to me, I'm sitting at my desk one day, and I'm looking at all these things involved in the school shootings, and two of the factors that were there every time was mental health issues and prone to violence. The third thing was somebody knew about it ahead of time. How many times have you seen these things? Somebody goes, "Well, I knew about that." Well, who'd you tell?
Right, every time.
That's right.
They didn't have anybody to go to.
Right.
But the prevention part wasn't there, because if we could have got to these kids or whoever's involved in this ahead of time, then you don't have to take the action on the other side.